So I think that everybody understands that loss of estrogen, loss of progesterone,
Yeah.
loss of maybe even testosterone as well can lead to different types of hair loss. And we'll talk about that in a moment. But I wanted to zero in on inflammation, and you mentioned zombie cells as
Mhm.
well. So what is the effect? Like what is happening on the scalp that is causing, is it the hair follicle that becomes a zombie cell? Where are the zombie cells?
So we have the scalp tissue that's mainly the continuation of the skin, and you have the hair like go inside this scalp into this hair follicle. This hair follicle is formed by several different type of cells that are producing the hair. And when the cells around the hair follicle, some of them starts to become damaged, start to become senescent, zombie, and secrete inflammation, this start dysregulating the other cells and they cannot be producing their hair as well as they were before. So the accumulation of the senescent cells on the hair follicle increase inflammation in the hair follicle and then leads to an acceleration of the thinning and the shedding of that hair and moving out of the anagen phase. So for us at OneSkin, when we start to learn that the zombie cells are playing an important role on this thinning of the hair, was when we start to connect, okay, maybe we can develop something. We have our peptide. And if we reduce the cellular senescence in the hair follicle, we may create a healthier environment for the hair follicle that will allow the growth of the hair and the growth of the thickness of the hair.
Okay, so you said a lot of important things there. Obviously, I've been a fan, huge fan of OneSkin for a
Yeah.
long time for skin. I was actually just asked last night, I was coaching a group of women. And they were like, we were sort of wrapping up a course together. And they're like, okay, last question. Tell us everything you do for your skin.
Yeah.
Right. So I know that the OS1 peptide does wonders, at least has done wonders for my skin. And of course, you have lots of studies to sort of back that up. But what is okay, so when you are talking about the peptide, the OS1 peptide, putting that on the scalp now can reduce some of the inflammation that you're talking about, reduce some of the zombie cells in that little micro environment in and around the hair follicle. Is that what, like the cells and the ones that produce the hair follicle? Okay.
Yes.
Okay, so let's talk about women and men in terms of the way that we lose hair, because one of the things I was telling you before we started was that I was starting to notice like just like where my part is. So if
Yeah.
you like right now, I typically like to part my hair in the middle. It may change, however, because when I flip it elsewhere, like
Yeah.
I was finding that the part was much tighter elsewhere, and I was like, oh, I'm starting to see like a little bit of widening there. But
Yeah.
that's not like, whenever we think of hair loss, at least for me, I would often think of like the thinning of the temples, maybe the crown. That's more of like a male pattern. We also see that with women with PCOS. They sort of have that male pattern baldness that happens. But talk to us a little bit about the different types of hair loss between men and women.
Yeah.
And then my sort of second question is, if we have these things like the stress and the inflammation and these zombie cells and our hormones are changing, like how can we determine what is happening? How do we know if it's senescent cells and zombie cells, or is it hormones, or is it we just have to assume that those things are happening together? So first question, male and female hair loss patterns. And then how do we parse apart, if we're in our bathroom doing our hair and we're like, gosh, like I really feel like my hair is changing.
Yeah.
How do we determine what's happening?
Yeah. So the male, as you said, like usually the baldness pattern starts either here on the crown, sometimes on the front. And a lot of that like big loss that you see on men is associated also with an hormone, DHT. And that's like causing that loss of hair. And once that hair is completely gone and you start becoming bald, it's very hard to make that hair follicle regain hair. So it's very important to be aware when you start losing hair if you want to be preventative on preventing that hair loss, because once you are completely bald already, it's very hard to reverse that. To be like one of the main
Like
ways
once
you can
it's
do
gone,
that,
it's gone.
it's
Yeah.
gone. It's
Yeah.
like when you do a transplant, then you regrow that hair follicle, the bulb there, and you have the hair again. So men experience a lot of that crown and sometimes also on the front. And the female, when they have this kind of baldness, is usually more in the front here.
Yeah.
And sometimes it's associated a little bit more genetic as well.
Yeah. Like
The
even the
type-
hairline, like even at the front, right? Like you
Yeah.
notice, I mean, at least that's what I'm like, I think it's getting a little thinner there. That's how I sort of feel about it. Yeah.
So the way I understand, especially when I see like our hairline is a part of our scalp that is less protected. It's more exposed, right? When we go outside, sun hits more on this area. There's more exposure of damage on where we are part on that hairline. And that can be accumulating a little bit more of damage on the follicles around where you are cutting your hair. So that's why with time you start to see that opening. And sometimes if you go to another side of your hair, you don't see that much, it's a little bit more protected. So it's all like related a little bit with this accumulation of damage on the scalp as well. And that's somehow like you end the experience that when you where you are opening your hair with time, it's a place that you notice more of this hair loss.
Yeah. So we have this sort of difference between men and women. So men is like the crown, as you were saying,
Yeah.
maybe at the temples a little bit. And
Yeah.
then women, sort of what I'm describing to you, what I was starting to notice, like the part is starting to thin a little bit, maybe even at the hairline.
Yeah, the hairline, sometimes even a little bit on these temples. I have a little bit on this area.
Yeah.
Yeah.
Okay. And so you said prevention, which I think, I mean, I'll be honest. I think this is the only place where women are like, yeah, I got to get on this train. Like I spent 20 years in private practice working with rehab and like, you know, sports injuries and all the things. So I'm like, you got to do your rehab. And as soon as the patient felt better, they were like, yeah, whatever. I'm not going to do my exercise anymore. But I think that this idea that you just have a small window of opportunity to revive the hair follicle, like once the hair, you know, that little micro environment in and around the hair follicle is, let's say, toxic enough, either with the DHT that we were taught, like the excessive testosterone, or there's, you know, too much accumulation of these zombie cells that you've been talking about. Once the hair follicle is no longer able to produce hair anymore, it's like you have to get ahead of that. You know, if it's like you're on time, you're already late. Like you have to get behind it while your hair is looking good and try to prevent it that way. I was actually talking to, this is a bit of a sidebar, but I was talking to my friend, Dr. Vonda Wright. She's an orthopedic surgeon. And we were talking about, just casually, we were talking about vaginal estrogen. So I know this is not related, but she was like, vaginal estrogen, if you start it before you have problems, right? You're always going to have, like, let's say a healthier sex life, right? It's always, you're never going to experience that clitoral atrophy and all the things that can happen with it. And I think that the same is true here. If you get ahead of it before it starts happening, then, you know, that trauma, that, you know, that I think devastating thing will never happen. Yeah.
Yeah, it's with everything. Like now, more and more overall our health, the more we take control and we prevent any kind of disease or condition, it's way easier and more beneficial at the long time than trying to solve something that it's already like too advanced.
Yeah.
And even on the skin, like if you start a good skincare before you have deep wrinkles, you will preserve that quality on your skin for longer.
Yeah.
And the hair is the same. But we are not so aware of like preventing this on the hair, and we start to take action a little bit later. So what we're trying, like, it's to bring this awareness that the earlier you start on this journey, like, it will be more beneficial. You yourself 10 years from now will be grateful for you starting this earlier, right?
Exactly.
Yeah.
So tell me, okay, so a lot of dermatologists, I was also saying this to you before we got recording, a lot of dermatologists, some that I follow on Instagram and whatnot, because I'm always like, I want to also know like how to, you know, what are the derms talking about? They'll recommend like a Rogaine for women who are experiencing hair loss, which is, you know, either like a foam. I think there's other versions of it, but the one that they seem to talk about is like the foam a lot. And they'll always say like, always get the male Rogaine, not the female Rogaine. It's just like more expensive. But I worry I worry about taking, first of all, I've read up on it because I was like, oh, let me look into this. And apparently you lose so much hair when you start using it. Like your hair goes into I believe it was the telogen phase, like the exiting or the exogen phase, where the hair just starts falling out. And then then you are sort of locked in to using it forever. Like once you stop using it, then everything sort of goes back to where it was. So I've already I've already stated my bias. I'm not a fan of it. But tell me about minoxidil, the finasterides. Tell me about what is it doing to the hair? Why is it being recommended as a hair loss solution? And then I'd like to also, because I am a big fan of informed consent, I'd like my listeners to understand what are the side effects, which I don't actually think are being discussed as often as they should be.
Yeah. So minoxidil and finasteride, they're two drugs that were developed to treat hair thinning and loss. Minoxidil, what it does, it improves the blood flow on your scalp, and that helps the hair follicle to stay on the telogen phase. And finasteride is a molecule that is blocking the DHT. So it's blocking the hormone.
Got it.
So for people that experience androgenic alopecia, that is really related with excess of DHT, the finasteride, you take orally, and that's helping like to block that excess of hormones that are causing the hair loss. So they have different mechanism. And one of the main problems with the minoxidil is that it can be very irritative. It can irritate your scalp, which is kind of like it's something that you're trying to be good, but it's causing some irritation. The type of the formula gives a lot of build up, and especially for a woman that has longer hair, it's hard to use every day and style your hair as well. And for hair thinning and hair loss, as for skincare, consistency, like you need a daily application to really see results. So a product that's a foam that does not give that good feeling, keeps your hair greasy, will kind of like not make you want to use it that much. And the minoxidil is known, like there is one of the side effects is that first you go through this big shedding. It's kind of like before it starts to regrow hair. Before it goes back to the telogen. And then that can be very traumatizing or hard for some people to, for the first 3 months, see like the opposite result. But if you overcome that phase and if you're not having a lot of side effects, you can see benefits. It has benefits in the long term of growing hair. It comes with side effects, but it's usually also recommended in a lot of specific cases. The male and female version that you see in the market is mainly due to the concentration of this molecule. The male version has a higher concentration of minoxidil compared to the female version because they experience a more hard like hair loss and has more, so they need more stimulation. So I wouldn't say to you, it could be more side effects if you use the men version on a woman because of this concentration. But both of them, they are more targeting like a condition, a disease of the hair loss related to the alopecia, to the androgenic alopecia, but not the age-related hair loss that's happening to all of us. That is more mild, but it's happening throughout the years. And something like that could be too harsh for your scalp, and it's not necessary to be able to regrow hair.
That's so interesting. This is why you should never take advice from social media because I've heard so many derms, like so many dermatologists will say, don't get the pink one, don't get the female Rogaine one, just get the male Rogaine one because it's stronger and it's cheaper. Like, the justification is often like, hey, you're paying more for less, so just use the male version. But that makes sense that maybe it's actually too strong for women.